nasolabial fold on the left hand side using the same technique, placing the implant into the deep dermis. I'm going deep into the deep dermis, and again the syringe offers me excellent control, and I'm able to inject very easily and very quickly, and the product's gone in, and the outcome is absolutely perfect. But in this lady, as I said, the nasolabial folds in this lady are not very deep, but occasionally we have a patient where the nasolabial folds are quite deep, in which case the implant would be deposited into the deeper part of the reticular dermis. So we have that here. We're nearly done. Again, I'm headed for the deep dermis. And one doesn't need to overcorrect at all with this product, and the outcome is absolutely fantastic. And a gentle massage is useful. I do it on the surface, and it's also possible to do it digitally by placing the finger inside the patient's mouth and doing it. If you could open your mouth for me, please. And this is a bidigital massage technique. So you can press the implant in place, and if there are any inconsistencies, you can feel them very clearly. Mind you, the implant should be modelled immediately after the injection, because if you try to do it the day after, it is virtually impossible. This lady has a rather deep perioral wrinkle on the right-hand side of the upper lip. It is a rather deep dermal epidermal fracture line, which I'm going to attempt to inject with Uma Jeunesse, placing the implant again into the superficial part of the reticular dermis or deep dermis, because the skin in the perioral region is extremely thin. Okay, deep, sharp scratch. If you have any pain, please. Okay, that's fine. Again, a very tiny amount of the product is needed, and once you've done that, a gentle massage. Mind you, the massage in this area should be done carefully because it can cause a bit of pain due to the underlying teeth. See, the wrinkle is gone to a large degree. So, okay, that's fine. Thank you very much. Now we'll attempt to treat this lady's chin. There is a very deep line on the chin, which I will again try to treat using Uma Jeunesse. Okay. There we are. How does it feel?
Okay.
Okay, right. Now I'll carry on with this. Okay, you all right there? Nearly there, last one there. So, and then we're done here. I think it's the one which is beginning to wake up, I suppose you think. Now, Uma Jeunesse is a very flexible product. Uma Jeunesse can be used for treating even the fine lines, medium and deep lines. Now, we're just going to try to treat this lady's crow's feet and glabellar frown lines. I'm using a 27 gauge needle which comes pre-packed with the product, but one can use a 30 gauge needle, change it to a 30 gauge needle if one feels more comfortable using a finer caliber needle for finer lines. But I feel that I work quite all right with a 27 gauge needle. This lady has quite deep crow's feet, especially the middle one, which has been done, has warped already for me. And my intention would be to place the product in the mid dermis here. And as you can see, it has been this particular crow's feet, this particular line is disappeared. Now there's another deeper line. Mind you, the orbital rim is here, and I will try not to cross that. I'm just going to put a tiny bit of product here, on the side here, and then try to massage it in place. Again, very tiny amounts of the product are needed, and you don't need to pump in or inject too much of the product. Always be careful of the superficial veins in the temporal area. This lady has a rather deep line here, and again I'm going to inject a very tiny amount of Uma Jeunesse, which will be massaged into place. There we are. Sorry about this.
It's okay.
Yes. As you can see, this lady had quite extensive crow's feet on the right-hand side, and they are significantly better. And it's been massaged in place and feels very good.